Whole Community Disaster Management webinar today. Again, we'll begin shortly, and if anybody's having any questions or trouble hearing us, feel free to throw it in the chat or Q&A. Thank you, Virginia. All right, everybody, good afternoon. Thank you so much for joining us here today. I know we have a number of familiar faces from across the country, and welcome to you all. Welcome everyone who's also joining us for the first time. Before we jump in, we'd like to offer closed captioning for the session. So if you'd like to opt in to view the live captions, please enable them by tapping the live transcript button down at the bottom and then select Show Subtitles. I'll say that one more time. Again, if you would like to join the live captions, to opt into that, please enable them by tapping on the live transcript button down below and then Show Subtitles. And you should be good to go there. Good afternoon and good morning to some. My name is Lauren Bonica, and I'm a director at Merit's Emergency Services Ready Now team. We're a company that, among many things, works to enhance disaster preparedness, response, recovery, and mitigation efforts with a suite of technology solutions that'll help to coordinate, deploy, and track our volunteers, our first responders. We also have a super cool 214 form that's electronic now, so can't wait to talk a little bit about that. Before I get started and truly introduce our phenomenal guests today, I would like to take a pause to our current communities that are impacted by emergencies, perhaps the daily life of cold weather, severe drought, conditions that are out of their control, perhaps those individuals who fear they might be forgotten, and then our phenomenal first responders, our firefighters, our law enforcement, our military partners who are out there serving each and every day. So we're so grateful for all of them. Our guests today are here to help us talk through an extremely important topic: equity, inclusion, and whole community emergency response, and how we as a community can continually work to do better at providing services for those most in need in emergency situations. Disasters can create tragedies for people of all backgrounds, but in their aftermath and before, those resources might be limited, and we need to do better. We need to change this. It's not going to happen overnight. It's not going to happen just on this webinar, but we need to keep having these conversations and switching the stories a little bit and making it better. We have that altruistic obligation to do this. Emergencies exacerbate those existing conditions. They show the gaps in our services. Together, we can make a change, and we look forward to talking about some of that today. I'm very pleased to introduce two experts who have been grappling with many of these issues for years and are here to share some of their great insights today. Chauncia Willis is the co-founder and the CEO of the Institute for Diversity and Inclusion in Emergency Management. Chauncia is certified as an emergency manager and cultural diversity professional with over 20 years of experience in disaster management, national security event planning, and immigrant and refugee outreach. Prior to co-founding IDIM, Chauncia served as emergency management in Tampa, Florida for over 14 years, where she led successful programs benefiting marginalized populations. In her role as the CEO for IDM, she leads efforts to integrate equity into all facets of disaster policy and practices with the goal of increasing cultural competence and mitigating the harmful impacts of bias on underserved groups. So happy to have you here, Chauncia. Our next phenomenal guest is Dr. Roderick Bowman, who is a seasoned emergency manager with extensive experience developing and implementing comprehensive emergency management programs. Currently serving as the Director of Northeast Operations at the Olson Group, Dr. Bowman previously worked as a Regional Disaster Officer for the American Red Cross in New Jersey, where he oversaw the Disaster Cycle Services Program, which focused on addressing preparedness, response, and recovery needs. Immediately prior, Dr. Bowman worked as a Senior Director for Emergency Management Operations at NYC Health and Hospitals, where he provided strategic guidance and tactical support to ensure the uninterrupted functionality of operations for our nation's largest healthcare system. Dr. Bowman served the state of New Jersey as the Deputy Director of Preparedness Bureau at the New Jersey Office of Homeland Security Preparedness and he's also a past member of New Jersey's Business and Industry Association and a member of the Diversity, Equity, and Inclusion Committee. Whew. I'm surprised you both have time to be with us today, but I sure am glad that you are here. Welcome, and I think I can invite you all to be off of mute at this time. And how are we doing? How are we doing, Dr. Bowman? How are we doing, Ms. Willis?
Great, Lauren, thank you. It's a pleasure to be here and certainly to talk about, this topic, which is certainly dear to me.
Yes, I agree. Happy to be here and delighted to jump into it.
I'd say so. I'm glad. So we've just so everybody knows on the call, we're gonna talk about some awesome topics for about 30-45 minutes. We also will take your questions and discuss what's going on. And we really want the three of us and our organizations really just want this to be the first of many conversations or the continuity of conversations that many of you are already having. So we'll begin with some of those. And let's start with some definitions, and they'll probably all still be different throughout the day. But Rod, if you could define some of the key terms that we'll be using during this conversation: equity versus equality, and how they relate to disaster management.
Certainly. Well, just looking at equity and very at its simplest form, how I define equity is fair and really without bias, right? So when you look at being equal, to give one person an apple and give another person an apple, it's equal but not necessarily fair. The other person might not need an apple or may be allergic to an apple, right? So and at its very simplest form, that's how I would describe the difference between the two. I don't know if Chauncey wanted to add anything to that.
I was just thinking about that because I always use the symbol of candy, giving one child candy and then giving the other child the candy that they actually like. So if you give me those candy corns, I don't like those. But if you give me a Snicker, I'm like, oh my goodness, that's great. So equity is really getting what you need. And when I define equity as it relates to disasters, I like to incorporate historical bias. If we don't acknowledge the historical bias that has led to a lot of the present day inequities, then we have missed the mark on truly understanding equity, and it can veer into the lane of becoming performative. So I love that you started with the definitions, because often that there's a challenge there in understanding the difference between equality and equity. And they have a great philosopher, I think his name is Joshin, who said, equality is giving everyone a shoe and equity is giving everyone a shoe that actually fits. So that's the most simplistic way to think about it. But when we think about it in terms of disasters, we have to acknowledge the historical bias that has led to present day inequities.
Outstanding. And let's start right there with some of the historical emergencies, disasters, catastrophes. We know they're all a little bit different, but all crossover, or blue skies that brought you to what you're doing today. Specific examples, so we can all have some things fresh in our mind. We'll start with Chauncey and then we'll start with Rod, to some specific events that really highlight why this is still something that is not where it needs to be.
Oh my goodness, there are so many.
All right, we only have 30 minutes.
Where do we begin? One of the things that I was on a webinar, I think it was yesterday or the day before, and one of the things they mentioned was how IDEM, our organization, the Institute for Diversity and Inclusion Emergency Management, on the day that FEMA received the reins to manage the COVID-19 response, we were hosting a webinar on inequities that would be seen with a pandemic. And it's not rocket science. Whenever you think about bias, the outcome is always going to be inequity for somebody. So whenever you're approaching disaster where there isn't enough representation at the table where they're making decisions, and wherever there's a failure to really acknowledge how underserved populations are made more vulnerable by the government's actions, by the inequities of policies. Whenever there's a failure to acknowledge that up front, the outcome is disproportionate negative impact. And as we saw with COVID, the price of that was people losing their lives, the economy essentially becoming destabilized, a new term that no one had ever really heard before, essential workers, and a prioritization on risking those essential workers' lives so that we could benefit from having all of our services continue. I think about all of those things, and I see the bias in that decision making. What makes them, more, what makes it right to put them more at risk so that we can continue having services? And those questions, we have to grapple with our own selfishness, our own inability to think as a collective that has the benefit of humanity at the forefront. We have to challenge ourselves to really think about how we can do better and not go along with some of the bad decisions that are made in times of disaster. You have to challenge that and think more deeply about what's happening. So I'll stop there.
No, I think I would like to say that COVID, your description was an example of the past, but it's not. It's the past, the present, and the future. And here we still are. So thank you so much. And Rod, the same question to you. How about an example to kind of refresh everybody's minds? Not that we know everyone who's visiting and joining us today, this is at the top of their minds always, but what's a couple that stand out for you?
Well, for me, Lauren, I really began in public health, and working in public health, you certainly, are exposed and deal with vulnerable populations, right? And you understand some of the needs, some of the concerns, some of the obstacles that, these populations have to navigate, even in, a healthcare or public health setting. And certainly as I started to transition my career from solely public health to more, broad emergency preparedness, disaster response, emergency management, more and more I began to see that, I would enter a room and no one looked like me at all, and many times the individuals that need the most help during a disaster or need the most services or direction or information are folks that look like me, right? So just seeing a lack of representation and really a lack of diversity in this great field of emergency management, right? And more and more we with efforts put forth by people like Chauncia, we're seeing changes within the profession, which is certainly positive. But for me, just coming from that public health background, and certainly shout out to everyone that's on the line that's a public health and healthcare worker. Certainly I understand the challenges that that were faced, as we all do during COVID and just doing just your daily operations, right? So thank you for the work that you do, truly healthcare heroes. But that's where I really first got my I guess my desire to work in this space and really to be a champion for diversity, equity, and inclusion in our field.
Absolutely. And bringing up essential workers, the choice of no, you're still going to work. I'd be remiss if I didn't think of my phenomenal communities back in Immokalee, Florida, our migrant and seasonal farm workers who 30,000 strong there, COVID strikes and get to work, get on a crowded bus, live in crowded housing communities, have limited access to educational materials, awareness, information, and access. So I do thank the state of Florida, who was really great in wanting to support those communities. But then there's also some things that we can do locally to really improve that. And this is not common to just that area. This is widespread, which brings us to our conversations today. We already have a great question, and it leads us a little bit into the next one. So let's go with it. And potluck for whoever wants to talk about, how does diversity and emergency response community impact how we ourselves are implementing our programs? So let's talk a little bit about the programming in that planning or that mitigation swing, and what programming and implementing the programs should look like, and maybe some specific things you've done that people can take away and get busy with.
So I'll go ahead and take that. So just clarify the question, Lauren. So could you repeat it, the first part?
Tell us everything you know is what's in
Well, that fits
going anywhere.
In this class.
Specifically, how can we implement better programming? And I would assume that also means plans or mitigation. So what about
absolutely, absolutely, and great question. So for me, being essentially a planner, that's my background, that's really my expertise. I understand the importance of collaboration, right, and bringing the right partners to the table. When we look at some of the needs in emergency management, and really truly some of the disparities that exist, some of those things can be addressed through awareness and partnership, right? So making sure that we work closely with our civic and community leaders, and our faith-based organizations, nonprofits, even the private sector, because they all are stakeholders in this landscape of emergency management, and their voices need to be heard, right? And their voices should be part and folded into some of the policy recommendations, some of the initiatives and some of the planning efforts surrounding emergency management, right? So if we're looking at that, truly that embracing that whole community approach, then we really need to do that and engage the whole community. And a lot of that comes too from building trust. That's a whole nother topic that we can talk about. There's certainly communities, vulnerable communities, marginalized communities that have a distrust for official government or in the like, and would be hesitant to participate in certain activities, right? So we have to build trust somehow through those leaders, through those through those channels, so we can really make a mark and make a dent in some of those barriers that we're seeing.
That's fantastic. Thank you so much, Rob. We really appreciate that. And one of our next questions, Chauncia, for you, we wanted to have your expertise on communities lack that access to public services as a result of society as a whole in the bigger picture. How do we ensure that underserved communities have a voice in disaster situations, and that locally they're folded into operational plans, but then state-wise and then into the federal government's kind of onset and operation and support?
Mm-hmm. Yeah, that's a great question. So, it really goes back to what Roderick was saying, which is that you have to know your community. That's number one. So we talked about it a little bit earlier, the social vulnerability assessments and understanding the demographics of a community, who has access to what, understanding the income level, the average income level of the community, really getting to know your community that you're serving at the local level. I have found that there is oftentimes, unfortunately, a disconnect. So I was speaking to someone in Louisiana, one of the emergency managers, and he was saying, in Louisiana, all of the emergency managers tend to be white males in all of the counties. Now, as we know, Louisiana is one of the more diverse states here in the United States. So when you have that lack of diversity, which can tend to serve as a challenge for the emergency managers, who might have difficulty connecting with the communities they're serving. I mean, you talked about examples of what we've seen and heard. I mean, I've heard emergency managers say, things like, I don't want to give those people any more, or how long do we have to keep giving them handouts? And these are the people that you're supposed to be serving. So you look at all of that, and we have to address that bias as we've discussed, because that prevents you from really operationalizing equity. And what we want to see is equity. And so when we think about the planning approach, we have to be intentional in making sure that plans are not developed in a silo. Many years ago, when I was working as the state planner for Georgia, one of the first things that they would have us do is host these planning workshops or sessions at the GIPSTID. And the primary reason we did that was to bring everyone together, so that everyone, even those who are representing the community, the faith-based community, different elements of the community, so that they could have a voice in the plan. So it's critical that as emergency managers, we not be afraid to go out into communities that we may not directly connect with on a daily basis. It's part of your responsibility. If you're in this job, if you're taking that check, then go ahead and do your best to connect, be a connector. And we are there to serve. So many times, even in my capacity as a CEO for IDEAM, I still deploy. I still go into people's houses after disaster. I sit on the couch, I talk. I want to know what you need help with, what's happening. How could I work with the local government to make sure that you're getting what you need, so that you have an equitable response and recovery, so you experience what it is like to have your needs met, even in times of trauma and disaster. We have to be intentional about serving our communities and not just taking a check and doing just the bare minimum of mandates, which most emergency managers don't do. It's just you have so much on your plate, and that's where the intentionality comes in. You got to give it that extra that extra push to get it done. So I hope that answered the question for the person that asked.
And Chauncey, I think you make a very valid point here, right? We really need to build a culture of equity, right? And you mentioned earlier the historical context of disparities and inequity, right? When we look at neighborhoods and the legacy practice of redlining historically, right? And now we see that those neighborhoods are at the highest risk of flooding, throughout major metropolitan areas, in our country, right? Those types of decisions have long-lasting impacts, right? And they were built upon a culture of bias and a culture of inequity. So what we're trying to do now, to Chauncey's point, is to build that culture of equity now.
Right now, I'm in New Jersey. It's pretty cold out today, a little sunshine. But some communities in New Jersey are legitimately using their stoves to stay warm. Not Lauren. Lauren's good. A little toasty from the webinar, especially, but our communities is turning their ovens on, and so are their neighbors. And they're turning their stoves on to stay warm. That's a basic human need. How could we possibly expect someone who's doing that to stay warm, to keep their family, their children, their elderly loved ones alive, to not freeze, to then get a message that we're going to get flooding, that there's high wind warnings, that you need to go get a COVID vaccine? If your every day is so critical to just change your temperature in your house by keeping your stove on and that risk, what can we do differently? Or why are we not doing this better yet?
Well, as I think about it, the truth of it is once we prioritize humanity and we understand that everyone wants to survive, So even if there is a cold freeze and I'm using my oven, if you tell me there's a flood, I still would like to, I still would like to survive. So understanding that at the end of the day, people are people, they want to live, but we have been trained that some people are expendable. Some people are expendable. That's how we're trained. I can remember being at EMI and learning the doing the most for the most theory, the utilitarian approach, which unfortunately, when you're doing the most for the most, you're addressing those who have access and have the most. So that's not the right approach. The way that we have been foundationally thought to believe and conceive our thoughts and our programs, our policies is incorrect. We need to prioritize the underserved, and we need to spend more time as emergency managers learning about how to serve those who have been underserved by the government. And we don't necessarily at this time take enough intentional time to learn about those communities that need additional warning, that need more prioritized services. And it's not because, of race or socioeconomic status. That vulnerability is coming from policies and practices that have intentionally created more vulnerability for them. So because they couldn't get a loan and they were redlined, they were forced to live next to a chemical regulator or in a high flood hazard area. It's not because they are Black, it's because they were not allowed to go anywhere else. So it's a different way to think about vulnerability and our role in perpetuating the vulnerabilities and not saying, okay, well, it's okay for some people to suffer with that. Hated that it happened. No, what can you do to intervene and make sure it doesn't happen? Take responsibility. Yeah, that's it.
When it comes to messaging, we want to use everyone. Let's send an alert out, and then we'll switch to the new question. Let's just email everybody. Let's send an email, a text, a blast. We have to remember not all communities are going to receive that. That maybe driving a vehicle around with audio is the best way to receive messaging and safety messages for some communities. Can either of you talk about some very unique ways that you've tried to reach communities? And maybe this question is for you, Rod, to get that emergency alerting notification out in different ways that we have to embed into our plans now to talk about blue sky moments. So when that flood does come, when that chemical plant does leak, when the tornado is on the way to Western Kentucky, that we have a messaging system, a way to communicate to people that are there in all languages, not just English.
Absolutely, and I think Chauncia said it well when she said that we need to know our communities, right? As emergency managers, we need to know our communities, and we need to be able to engage with our communities because there are pockets of the population out there that don't listen to mainstream media, maybe not, maybe don't have a cell phone, there truly are, but I can guarantee that there is a civic leader or a pastor, someone that can get information to that person. And what we need to do is really look at every avenue, right? Going back to that whole community approach, the whole community is truly the whole community, right? So that engagement piece, I think, is critical with any type of messaging, and certainly, the standard, blast distros, will certainly catch some folks, and some folks will weed through that stuff. But really knowing your community and knowing how to best engage and connect with the community is certainly something that's key for an emergency manager, certainly.
And I would just add to that, when I was in Tampa, I created programs specifically for the underserved communities that I was serving. So one of the programs was It Takes a Village to Save a Life. And that's where we would host a forum, whether it was in the EOC or at a different event, an event site, in some cases at a church. And we would invite community leaders to come in and discuss not only our plans, but also have an opportunity for them to amplify their voices specifically around disaster management and the phases of emergency management. Also, another initiative was Meet a Neighbor, Save a Life, where we encouraged the residents to go out and meet their neighbors. And that came from a response from, I think, Hurricane Irma, where I received so many calls in the EOC that the call center was overwhelmed, and it was really people asking for us to go check on their elderly parents. And we weren't able to because, high wind speed. So different, ways to think about community connections and service, and going outside of that normal, we have to send an alert. No, it would be best if we met with all of the pastors and we understood how they communicated with their membership. It would be great if we connected with the Asian American Association, so we could better understand how to connect with that community. And in fact, if we are having any issues connecting, then we need to welcome them to our EOC, come in, have a seat, run an inclusive EOC. So different things like that.
Excellent. There's been a sea change over the last few years in conversations about racial equity in the United States. Could you walk us through how you've seen these changes manifest in the world of disaster management?
Well, I mean, certainly, I think we all can agree that disparities and inequity certainly exists. I mean, there's a growing body of research right now that's looking at how federal disaster aid is issued at higher rates to whites versus people of color, right? So essentially, white people get more in disaster, post-disaster federal aid than a community of color, right? So there is research, in that area, and that research is actually based on federal data, right? So we really want to understand kind of why that's happening, right? And what we can do to implement change, certainly in those areas. And I think, as I said, it's no big secret that these disparities exist, and FEMA even recognizes these disparities in some of their policy changes, right? So the way that they administer individual assistance right now with their initiative to advance equity for disaster survivors, for example, is certainly a good step in the right direction on kind of laying the playing field and ensuring that folks get the disaster aid that they need. Thank you.
As we switch in one of our upcoming questions, we've gotten a phenomenal amount of questions from the Q&A section, and I'm going to pose two of them right now. And everybody, I do apologize if we can't get to all of your amazing questions. We would like to answer those, and we're going to gather them all up at the end and connect with Rod and Chauncia no matter what, to kind of get communicate or have you have their email addresses, and you guys can connect offline as well. One of the questions is about, someone mentioned being a healthcare worker. You're an essential worker, and a slogan we've all seen so frequently: heroes work here, right? It's great. Heroes work here, though, doesn't do much if I can't pay my rent or if I get COVID from being on the front line. How do you answer that when it comes to those vulnerable communities, again, being forced to work, or how that balances with inequity?
mean, that's a tough question, Lauren. I mean, that really is. I mean, so
I can't tell you who asked it, but it is a tough question.
I mean, there's a hierarchy of needs, right? We all have needs. We have to feed our families. We have to have our livelihood. And sometimes that unfortunately comes with risks, right? But how do we mitigate some of those risks? And that's certainly a question that's an onion that's gonna need to be peeled away at to come to a solution. I for one don't have an answer to that. So I'm throw it over to Chauncey and see what she can do with that.
Well, I think it's an opportunity to be an ally. Often we will take advantage of someone else's distress and not realize that we're doing that. So I heard someone say, and it was a phenomenal suggestion, I forget where I heard it, but she said, I'm asking the questions now when I go into restaurants, do you have paid sick leave? And if you don't have paid sick leave, I'm not eating there. And so it's like, wow, you know what? That is taking personal accountability and becoming an ally to people who are being mistreated. Because essentially what we're saying here is, how do we reconcile the unjust treatment of entire groups of people? How do we reconcile that? Well, there is no reconciliation. You have to change it. You have to become a better ally to force them to change those policies. More we could say about that, but the concept of essential workers, I've said it before, it runs in alignment with just being okay and having some people be expendable, and knowing full well that most essential workers outside of the hospital setting were Black and brown communities. They were lower income, frontline workers. And then within the hospital settings, they were predominantly women. So we are willing to sacrifice certain groups, and we should not be willing to do that. So that's what I would say with that.
I'll give you an easy question, Dr. Bowman.
Please.
No easy questions, nor easy answers. And thank you, Chauncey. In a disaster response scenario, how can technology innovation play a role in helping to deliver services to communities in need?
Yeah, that's another great question. I mean, certainly we live in the age of technology, right? We certainly live in the age of technology. And although I did mention that there might be pockets of the population that might not have access to technology, most really do, right? And certainly in a disaster response scenario, technology, especially like crowdsourcing technology, can be used to locate folks that might be stranded, during a disaster. I know during Superstorm Sandy, there was a great use of technology. I believe it was with a Hughes satellite to leverage their technology to identify where POS systems or point of service systems were, to understand where you could get milk and gas, because if those systems were on, the likelihood that other things were on, like being able to extract gas from the pumps, right, was available. So technology is a valuable tool if utilized correctly, and it's a lot of opportunities, and there's a lot of great technology that's out there right now that really kind of is geared towards emergency response and understanding where things are, even with GIS, for example, like ArcGIS, to in the layering capabilities to understand where assets might be strategically staged to respond to a flooding incident and things like that. So technology is there. We just need to really use it and continue to develop in those areas to have some strong pieces of technology for the work that we do.
Wonderful, thank you. And for Chauncey, could you tell us a little bit more about the work of IDEM and some examples of successful programs that you've had and you're implementing now?
Fantastic. One of my favorite subjects, myself. No, just kidding.
Talk about yourself, Cynthia, and don't stop until everyone hangs up.
No. If I had to say there was a life assignment that, I was made to do, I would say that it was to found and have the opportunity to work with IDEAM, because the amount of impact that we have been able to have and to influence at a very, at a small but also a large major level has been phenomenal over the last, I guess, 2.5, 3 years. When we started, there wasn't a lot of conversation about equity. And as you know, some of my experiences as an emergency manager have been fraught with heartbreak, tears, shame, and all kinds of hardship. And so personally, I've always wanted to prevent other people from experiencing those negative things and feelings, especially if you are an African American woman. You're a double minority, as they say, and so I've had to endure some crazy stuff. But IDEAM has allowed me to serve the communities and to serve the nation and hopefully the world much better, using the concept of increasing diversity, equity, and inclusion in all aspects of disaster management. So before, during, and after disaster, integrating and being intentional about integrating diversity, equity, and inclusion, ensuring that new emergency managers are taking our courses. We have IDEAM University, where we are teaching the foundations of diversity, equity, and inclusion in disasters. We're producing guidebooks like how to communicate with immigrant and refugee communities. We just launched another program, the equity response teams, where we're going out post-disaster to identify those communities that need more attention, that need to have their voices amplified and their perspective post-disaster. And also working with them to ensure there is equitable mitigation funding going into those communities. So, I could, talk a lot more about that, but we're doing quite a lot, and we are have plans to do quite a bit more to ensure that, one of my major concerns right now, I'll tell you, is climate change. We know that over the next 30 years, more of our vulnerable populations will become economically disenfranchised, which means that they're going to go from being middle class to being in poverty. And it's going to be directly related to climate change. And so one of our goals is to find ways to intervene, whether it's through regulation, whether it's through changing policy, or even coming up with different programs to ensure that these communities can participate in their own resilience building. So I hope that answered the question.
For that. And you had mentioned some of the training. Is that available now? Do people register as a member of your organization? Can they get this training through your website?
I think it's so phenomenal that people want to register as members, but we don't have a membership. I don't think we can manage that. My team is a bunch of emergency managers and researchers and DEI strategists, and they would quickly tell me we did not sign up to manage a membership. So, however, you can definitely get involved in our courses. We are going out all the time to teach, but also we have virtual courses, and in April you will see our courses online. So we're excited about that.
Thank you very much. Rod, one of the questions we got was, how do you fund programs like this? But that also overlaps a little bit into recovery of cost recovery for emergency managers and then the community. And do you have some examples of cost recovery strategies that can help bring resources to these communities that need the help before, during, and after?
I mean, certainly, having someone that understands FEMA's public assistance program, right? Because there's complexities and how that program is administered and some of the record keeping and things like that. In terms of best practices, right now, I don't think I could necessarily point to a best practice, for specific cost recovery. But in terms of funding programs, I actually like the nonprofit security grant program, right? And that program is intended to integrate the nonprofit preparedness activities with that of state and local government, right? And it really does provide an opportunity for nonprofits, faith-based organizations to lean forward and receive training in in emergency management, to use funds to harden their facilities, strengthen their infrastructure around their facilities, right? And really gives them an opportunity to have their voice as part of the discussion. I think there should be more programs that kind of focus on building relationships and engaging with the faith-based groups in particularly and other civic organizations to kind of help drive resilience at the local level. Again, if folks aren't aware of that nonprofit security grant program, is certainly something to look into if you're in a faith-based organization or a nonprofit company organization, to help bolster your preparedness and your security of your organization. So I don't know. I kind of went around the corner to answer that question.
No.
Yeah, I got there.
And I think when it comes to cost recovery and mitigation, that's why the private groups, which some of us represent here, public agencies, government agencies, we have such an obligation to work together beforehand, to have these conversations, to take a look at the plans, to just take a look at 2 or 3 things that went wrong and how, if it happened again today, it should not happen again. And maybe before we wrap up and follow up with some more audience questions, you've got about 200 people on this call that are so excited to be here and listening to your expertise and to your advice and want to make changes in their community, perhaps in their agency and in their leadership style to move that needle. Give us 3 critical pieces of advice that you would advise everybody on this call today that they can do this and that they can be part of your charge and what they're doing already. Chauncey, I'll start with you and then we'll move back over to Rod.
Okay, well, first I would encourage all of the organizations to receive, prioritize and commit to diversity, equity, and inclusion. That would be the first thing. And then I would say definitely contact IDEM or, I was going to say or an organization like, but I think we might be the only ones, but still contact IDEM and allow us to work with you to assess your equity outcomes. And provide that training that's needed, that cultural competency training. And if you're an emergency management organization, hire more mitigators. Hire more mitigators that can provide competitive grant writing if you have the option. One of the quickest and most efficient way to create change in vulnerable communities is to bring money into those communities to really assist in critical infrastructure improvements and those areas where they have been underinvested. And so we need to make sure that we're bringing more funding into those communities. And we can do that through prioritizing those mitigators. And as I said, equity has a place in mitigation as well. So equitable mitigation will be the focus there. So I would just recommend those things: commit to equity, receive more training and understanding around diversity, equity, and inclusion in emergency management, and then hire more mitigators, not more planners, more mitigators, because you will have a choice at some point. And usually we lean towards plan but you need more people who can actually do now. We need to operationalize. So that would be my suggestion.
Outstanding. Wonderful suggestions. Thank you. Rod?
Thank you, Lauren. So absolutely, I think number one, make community resilience the number one priority. And with that, it kind of encompasses, that the engagement piece that I talked about earlier, partnerships and leveraging relationships, right? To really ensure that we're moving the needle in the area of community resilience. Secondly, I would say explore, identify, and take training in diversity, equity, and inclusion, right? And finally, make equity part of your culture, right? Create that culture of equity that we spoke about. When as a community leader, as a government leader, as just a leader in general, if you see something that's not right, if you see something that just doesn't sit right, speak up and be that voice. A lot of times, a voice goes unheard because that voice didn't speak up, right? So certainly be that voice and speak against any bias or inequities that certainly exist. And I like Chauncia's and I'm going to steal her as a 3.1. Hire those qualified people that really can operationalize all the stuff as a planner that we put together, right? Everything that's compiled and now does need to be operationalized, right? So making sure you have the right people, a diverse workforce, a diverse force that's reflective of the community.
In your diverse force is a great springboard into an outstanding question that we got from one of our attendees. And I'm going to read it directly from, so I don't mess it up, because they said it much more brilliantly. How do we diversify and value different experiences and backgrounds for hiring? Essentially, how do we quantify and qualify different social or economic experiences to support job performances and hiring so we can make these changes? When the planners are only coming from one experience or one background or one perspective, then our plans will be limited from those eyes. And Rod, if you can comment on that.
Yeah, I think we're doing a better job at kind of that right now. I think in emergency management, at least in the field of emergency management, you would see historically us being, comprised of, police and firefighters, right? And which has typically been a white male profession, right? And that's just an intuitive transition to go from, fire and law enforcement to that of emergency management. Now we're starting to see a broader spectrum of diverse candidates in emergency management that we certainly need to give the opportunities, and it goes beyond diversity of race and ethnicity. I mean, diversity of thought, gender, sexuality, all those things need to be certainly considered as important and critical needs of building a diverse workforce. Certainly, just opportunity and being aware of opportunities sometimes is a struggle. Emergency management is not necessarily a field that your average high school senior would say, "Oh, I'm going to go to college and I'm going to major in emergency management." And I think a lot of us have kind of fallen into our roles in emergency management, and now we're starting to see those programs kind of build and grow. But I think there might be certain groups of people that aren't aware of opportunities, in this space. So being able to raise awareness and put opportunities in front of populations that may have not ordinarily understood that a career path or a livelihood could be made in these areas, and that it's broader and bigger than police and fire.
Thank you. All right, we are almost at the end of our phenomenal hour together. So I would like to give Chauncia and then Rod an opportunity to just have a couple minutes to talk a little bit about anything you want about this topic, about emergency services, about making this reach to our underserved communities better. It is at the top of FEMA, who we all kind of look at for what is our federal government doing, and underserved communities is being mentioned every single time we see a demonstration or a presentation. But then now, but then we want to get to that next, and you are that next. A lot of responsibility, but you are that. So please take us to that next.
Well, like I said, when we started IDEAM, we met with FEMA to go over these concepts years ago. So I'm happy to see that many of the concepts are being actualized, and the recommendations we're starting to see those actually be implemented by FEMA. I would say that the next is really to invest more in community-based organizations. If I were to sit down with FEMA right now, whoever it is, and talk about how to do this a little bit differently to get better outcomes, I would say instead of directing money to local governments, begin to direct funding to community-based organizations that are already working. Find ways to support the work that they are doing. As an organization, that's what we do. We don't go into a community because we know we're leaving. We go in to support the community-based organizations. And also when it comes to increasing diverse representation, we have a number of programs like Hurricane that anyone can support, where we introduce emergency management to young women, young girls, young women, and also the Julius Becton Scholarship Program for those who are interested in entering the field of emergency management. Support that program as well. So, thank you.
Thank you, Chauncia. Rod?
I mean, really, I think, the fact that we're having these conversations means a great deal, right? That, we can have a discourse and a dialogue on, inequities and emergency management, and, in some of the things that have happened historically, and some of the things that need to happen, as we move forward. So I truly am optimistic that we're going to get where we need to be. And I'm inspired really by, the students that I teach, as a professor of emergency management, working with students and understanding some of their experiences and kind of their passion and their awareness of the need for DE&I is really just going to strengthen the next generation of emergency managers and have it on their mind as an awareness that, as we operate, we have to make every person, their safety and well-being a priority, and we have to do that in an equitable and conscientious way, really. So I truly am, certainly inspired. And Chauncia, thank you for the work that you do in your group, which is another great component in this mission, right? To kind of, improve DE&I across the board, and particularly in emergency management. So I applaud you in your group for the work that you do. So thank you.
Thank you. You as well. Thank you. Appreciate it.
Dr. Roderick Bowman, currently serving as the Director of Northeastern Operations at the Olson Group. And Chauncia Willis, currently the co-founder and CEO of the Institute for Diversity and Inclusion in Emergency Management. On behalf of Merit, we thank you both very much, but I believe most importantly, on behalf of our whole community and our all hazards team that want change, that are out there trying to meet with each individual and their organizations, and then bring that locally, then to the states and to the federal government to move the needle and to make it different for all communities, for all our underserved populations. We are most grateful, and we thank you for your leadership and the change you keep making. Thank you so much to everybody who joined our programming today. You will get a follow-up email or a few from Merit. Please feel free to leave some more questions, share your feedback and some new topics. If anybody would like to connect about technology and what we're trying to do with Merit and in supporting the underserved communities, please feel free to reach out to us at any time. We look forward to working with all of you. Again, on behalf of our team, thank you, Chauncia, thank you, Rod, and be safe, everyone. Have a wonderful day and thanks for joining today.